All right. Good afternoon, everyone. Thank you for joining. We are here today to talk about some very exciting things. We're going to talk about Vital. We're going to talk about some MedPay solutions and some ways to increase your traffic at your facility and everything else that happens moving up with your patients. So today we have Chris Warren, which is me, Dr. Sejal Patel, board certified plastic surgeon, John Lee, payments person extraordinaire. How's that, John? And
Yes.
Sejal Patel, who runs the marketing for the Ad Vital program. So, as part of that, I'm going to turn this over to Bijal to go through the seven P's.
Okay. Well, we wanted to walk you through exactly what you're going to cover, what we're going to cover on today's presentation. And we wanted to break it down into a framework that makes sense and most importantly, solves your practice's next layer issues. So we're going to cover the problem, that's going to be Cethal. Then we're going to move on to proof, that's going to be moi. Then we're going to move on to profit, payment extraordinaire, John. Then we're going to move on to the patient, which Cethal can cover. Then we're going to talk about the platform, that'll be Chris. We'll move back to the product and the roadmap that we're developing. I think you're gonna be stoked to see what Cethal's ideas are. They're amazing. And then we're gonna end on the people, and that's me. I'm a people. So you'll see me asking you questions. Feel free to say hi in the chat. Let's ice break this conversation. We love to hear from people, want to make this as engaging and fun as possible. It is a Friday, so happy Friday. And also, I want to invite you, stay until the end. We will finish at time, so we'll finish at the top of the hour. And Cethal's going to show you how to run a free 20-minute revenue audit for your practice. So this is something that we do complimentary. We get it done. We want to respect your time, but we want to give value just on top of what we've already learned in this industry.
Yeah, great intro. So, most practices, they're leaking revenue. And the reason I know this is because I have a practice, right? I started mine 10 years ago. And fortunately enough, I grew up in business. So, I'll give you a little bit of background in terms of who I am, why we got here, and how we got here. So, I'm a plastic surgeon, but I started and I grew up in a motel. And, surprise, surprise, Patel Motel, right? And so with that Patel Motel, I learned all the different ins and outs of business. And, thought I would never have to use it ever again since I was going to do a white collar job and I was going to be this doctor and, get out and do all the training. And, 17 years later, after all the schooling is done, I open up a private practice. And I realize a lot of the tools are missing. All the ones that I had learned in terms of the motel nights and marketing and business parts of what it took for a small business, a lot of them were all broken and kind of scattered, right? In terms of different platforms, different processes, or none of the processes and no platforms, and people just hope and pray, right? Or throwing spaghetti at the wall in terms of marketing. So when I started my practice, I realized, hey, there's this gap. And I asked other people to fill it, and they decided that the answer was no at the time. So that's where we started our entire platform from that kind of moment. And then, Chris, can you go to the next slide? Now, what I learned along this journey is, hey, how do practices keep up? Well, for me, like I was in business, 17 years ago before I went to med school, and then I got back out into business, and I was like, what's changed? Like, what has changed in terms of the market? And this is the same question we have to ask ourselves in terms of the practices, right? 10 years ago, you'd open your doors before they called, right? You didn't have to wait for anybody to show up. They just showed up and people walked in traffic and the other stuff. And you accepted payments when people showed up. Great care spoke for itself, and you had patients that came to you because of word of mouth or referrals. And that was enough. Well, things have changed quite a bit in terms of the time. Like AI has come out. Now people are asking AI all types of questions. Who's the best plastic surgeon for this? Who's the best dentist for this? All right. They're searching ChatGPT first. They are looking for instant access, like flexibility to no end, right? To say they want to have their payment processing to be flexible. I want to be able to pay a certain amount. I want to be able to get my procedure done here, and it's on their terms. They want to compare in terms of practices to say, hey, which one is has the best reviews? Which one does a better job for what I need? And they expect this all digitally, which means 24/7, 365, right? And so they're having to compete with larger systems, larger practices out there. Well, how do they do that if they just started the practice or they're not 25, 30 years in? Well, how do you compete with them? Well, we figured out it was the key to this entire process was the system. And so the system is not having more staff. Because when we learned this really hard lesson during COVID, when everyone evacuated and we didn't have any workers and we didn't have people that showed up, you didn't have staff to do some of the things. So what really happened is there's a huge technology boom in adoption in medicine to say, oh, all of a sudden insurance companies are going to pay for televisits. Why was it such a barrier before? Well, because there was no incentive behind it. Well, after COVID, they had to do it because they wanted to keep everyone safe from COVID. And also, they didn't require more staff to do those televisits. It was just the physician and the patient, right? And so, what we figured out is that these systems, and these systems are six core ones that we actually defined to say, how do we actually make a practice show up, profit, and take care of patients? It's the AI and automations, centralizing communication, smart scheduling, HIPAA compliant payments, right? That's super important. And the rest of the team is going to go into more of that as we go through this talk. Marketing attribution. I can't tell you how many different marketing agencies actually message me on a day-to-day basis to try to earn my business because they know we're easy targets to say, hey, we drove you this many leads and then it's on you. Well, if you don't have any systems in place, they can drive me 3,000 leads, but it's like putting a billboard in the ghetto, right? You're not getting any traffic that's actually going to convert to anything. So we needed attribution. And then the last part of it is having reporting to say, where are the leaks? How can I figure out how to run this business profitably and also do my marketing, sales, patient care, retention, and follow up and build a brand in terms of reviews? So we combine all those things into one system that the practice can run and it talks to each other. Can you go to the next slide, Chris? Key components, the biggest levers in practices nowadays, right? Most leads die within the first 5 minutes. This is based on MIT data out there. MIT data says, hey, if you can respond to them within 5 minutes, you have a 900% higher chance that they will actually show up to your practice. Well, if you don't have any automations and you don't have any staff that are actually willing to call these people in the 5 minutes, 24/7, they're not just expecting this during business hours. They're expecting it after hours, weekends, it doesn't matter, right? And you have nothing to follow up. They're literally going to the next person that will follow up. And so the winner is a person that follows up in that 5 minutes. It's not about the accolades, it's not about the certificates, it's not about anything else other than are you available when a patient is looking for you? We'll go to the next slide. So this was the leaky funnel loop that I just mentioned to say, hey, an average practice nowadays, they only convert about 3% of leads to actual procedures or patients. And this is dental, medical, all the above. With AdVital, centralizing communication, organizing it in a way that the staff can manage it, marketing, remarketing, and reporting, now we can 5x that, right? So you can take it 3% to 15% in terms of a change, in terms of a practice, to have a channel marketing that's going to work for you consistently. We'll go to the next slide. All right. And so these are all the different systems that we have found in a practice. And I found it when I was starting my practice to say, hey, what do I use for an EMR? What do I use for scheduling? How about marketing? Is there separate reporting? CRM platform. The letter CRM, 5 years ago when I was talking to other practices about CRMs, they didn't know what the letters stood for. They had no idea. In medicine, it's so naive to the entire concept of customer relationship management. And is even so much so that when they even tried the terms of patient relationship management, as other companies did, nobody understood what that was. So what we were able to do is combine all the technical tools for a CRM and make it a complete system. This is an EMR with automations, with a CRM, intelligent scheduling, AI marketing campaigns, real-time reporting, and patient-centered integrated payments. Now, this is the biggest unlock for practices that's out there. We'll go to the next slide. So from the first click, the whole goal is to make a raving fan, a lifelong patient, right? Somebody that tells their brothers, their sisters, their friends about the practice. Well, how do you do that? Well, it's about the experience. It's how you make the patient feel. And this is captured in the beginning. We have an AI receptionist. She answers every call, text, DM, qualifies these leads, and books consults, right? That converts into a unified patient story within our platform of our CRM and scheduling. Then we're able to actually collect the payments in terms of Vital Pay, offering patients the ability to pay by ACH, credit card, and financing, all in one HIPAA compliant place. And then we're able to retain these patients in terms of re-engaging with them, review generation, recall, real-time reporting to say, hey, where are these patients coming from? Where are my best patients and where are the worst ones? Sometimes even the worst one information is more important than the best ones because you know where not to spend money. All right, I'll hand it over to Bijal to talk about how to capture and convert the proof.
Well, I love this because first you've heard the problem. You know what we're dealing with as practices in this industry. And now let's get to the proof. Like we know what the problem is. How can we actually capture and convert these people in one place? So one of the issues is there are a lot of solutions in this industry. We've tried a lot of them too. But what happens is everything is like in a disparate window. So imagine having the best solution possible, but it's spread over typically 4 to 6 different apps or softwares. What ends up happening? Nobody is talking in one singular place, and it takes the practices and their staff's mental load and just pushes them over. So what we want to do is to be able to take all of that and streamline it into one place. And I'll show you how we did that with one practice in particular. So this is a real practice. When they came with us from AdVital, they're based out of Austin. It's a really prominent plastic surgeon, so we're under NDA with them. But they literally came with us with 320K of revenue a month, which is an average plastic surgery office here. In the matter of about 6 months-ish, they ended up moving and jumping all the way to 2.7 million a month. Absolutely incredible result. So that's about 8x result. Now, those results are so outlandish, it may not even hit you as believable. And I think that's part of the reason of understanding how the platform works so effectively. Would this had happened, the surgeon, great person, great results, and had already been doing the marketing stuff. Like this wasn't somebody who didn't know anything about anything. They had been in practice for years. The difference is all the different channels weren't talking to each other. So what happened is this person was never able to get attribution for where should they double down. So I just wanted to be able to show you this to see, look at the numbers, see them for yourself. It's absolutely incredible. And this person's practice has continued to thrive. So if you want to see numbers like this, just I mentioned at the beginning, we're doing a 20-minute absolutely free revenue audit to take a look at where are your leaky buckets. This is totally discretionary. It's under discretion and it's totally private between us. Okay, so this goes nowhere. Just like we protected the other surgeon, you will never have to disclose what you don't feel like it. But what we're going to do is detect exactly where you've lost revenue. We're going to look at your payment workflow and we're going to actually look at what's going on with your billing, what are you paying fees on, and then we're going to do a growth strategy session all within those 20 minutes. So what does this do? Cecil and I run a mastermind specifically for plastic surgeons and their staff. It's called the Catalyst AI Mastermind. And what that does, it allows us to look at dozens of practices numbers, what they do, how they're set up, and then create customized information for you. So this is no pressure, no obligation, but if you do want to book that audit, it's going to be with me. You can just go to advitalmd.com and hit that book a demo button. Otherwise, you'll get a link after this webinar, and I'd love to help you and see what I can do. Okay. All right. So with Kaya, let's talk about Kaya. She is one of our latest products. I call her a she. She is our AI receptionist, and she's absolutely amazing. She's been trained with so many hours. Cecil, How many hours did you spend on Kaya? Conservatively.
Yeah, probably too many, right? In terms of this, it was probably, you know, months and months of time and analysis right afterwards. So it's not just building her, but it's also evaluating, seeing how she thinks, seeing why she thinks a certain way, and how to keep her in check.
We almost had a conversation about Kaya.
Mhm.
There was so much time spent with her. But no, all joking aside, she absolutely knows the industry in and out. And if you want to check her out yourself, you can go to advitalemd.com and she's on there and you can call the number and you can have your own session back and forth with her. It's based on lift plastic surgery, our practice, but you can absolutely try to get a consult for facelift if you want to. If you want to do a mommy makeover, just go ahead and if you're a guy and you want to do a facelift or Botox, ask her any of the questions and see for yourself. And she's amazing. I will also say this, Kaya has a sense of humor. And that's absolutely, I just love the fact that she has a sense of humor. Could we go back one slide? So, what does she actually do? She handles 71% of our front desk. So, it's incredible. These are actual numbers. 1,280 84 inbound calls. Connection rate 96%. Now, let's look at the call to consult. This is the most important KPI if you're a practice. How many people who your staff picked up the phone convert into a consult? She's at 38%, which is at the higher end of what a front desk person does. And then missed call recovery at 84%. Okay, so what gets said on these calls that allow people to book? So first of all, Kaya is 24/7. She's after hours, she's on the weekends, she's never sick, she never calls out. And during practice business hours, a lot of practices, if you're like our practice, our people are amazing. Like our staff is like top notch. We love them. It's an honor to work with them, honestly. And they still are busy sometimes during the day. Like today, our clinic is just nutso. It's absolutely nutso. So they don't always get to the phone despite wanting to. So we can turn her on too after 4 rings during business hours. She can also pick up the phone. So this is conversion intelligence, which is part of what our AI does. So not only can you listen to her calls later, so when Kaya picks up the phone, you can go and check on how she did, and then you can rank her yes or no. So these are the signals that we've learned. What ends up getting booked more? Hey, when's the soonest appointment available? Walk me through what's included, and then do you offer financing? Those are patient signals to say this person is a really, really good consult opportunity. What loses the booking typically is when a patient says the famous, let me think about it. Of course, you have the bajillion, how much does it cost line, especially when it's cold. And then, are you in network? And Kaya is handled to handle any of these signals and objections differently from one another. So when callers call up to ask about the price, Kaya first redirects to the outcome and she talks about financing before she actually quotes. So she has an amazing objection handling and she knows how to handle the frame. Again, like I said, try her for yourself. Go to our website, advital.md.com, and give her a shot. So this is 1 real month with Kaya. So this is our plastic surgery office in May of this year. Check this out. These are actually inbound calls, and there is a voice that you can listen to later. We got 221 calls. Out of that, 25 booked appointments. 84 calls were transferred. So we can set up a call IVR and link into your current system if you're using Ring Central. And overall, I think this is the biggest, scariest monster in the room. She is a 99% positive sentiment. Like I said, she's a likable gal. Like I think I'd be friends with her, honestly. Like she's a cool girl. And so this is the amount of actions that she triggered. She can transfer, she can update the contact field in our CRM. She does appointment booking. She sends SMSs after to confirm your appointment. And the triggering of workflows happen just through talking through her. Okay. So beyond Kaya, who's basically our front desk receptionist, we also have a conversation AI. Again, these are real numbers, and this is a dashboard we provide live within your practice. So you can see this anytime with your own numbers. And it's really fun. You can change the dates to be, 1 week, it can be 1 day, it can be one last month, it can be a set time period. So all of that flexibility is there. Real-time reporting, which is with the numbers and KPIs that you actually want to see. So every text, every DM, every single thing can get handled automatically, qualified, answered, and booked. Now, what we did last month was we had 100, let's go back. We had 132 unique contacts. We ended up booking 15 appointments through those conversations that were automated. 614 messages got handled, and that saved our staff close to 2 hours, 1.7 hours of time. So this is absolutely incredible. And I want you to know one thing. If you're a practice and you're a bit, let's say you're a little sensitive to your AI usage, you can actually you can put it on a dimmer switch, I like to say it, and you can put it on that she automatically replies right away, or that there is preset responses like you may have seen in your Gmail and things like that, that you can still decide what you want to send and then it'll send it out. So you can just let her loose or you can do the preset. All right. Centralized communication. Cecil talked about this at the beginning. Having all of these different channels make it overwhelming. There's too many windows. So our inbox is one centralized one. It takes phone calls, everything coming in from your website, the emails in and out, your social media DMs, your Facebook, your Instagram. We're huge onto Instagram and Facebook and places like Real Self. It all comes into one place. So your staff isn't going crazy trying to chase inboxes and figure out what's going on with communication. Now, the booking funnel, this is the end to end. This is from the actual call to them actually keeping their appointment and showing up. So these are what the numbers look like. So inbound calls, again, front desk 24/7. Kaya picks up 1,284. She had a connection rate of 96.4%. So that's 1,238. Then who was actually qualified for the consult? So she doesn't just talk to them and book them randomly. She'll actually qualify them. So once she qualifies them with both, their medical intent and their fit and their aesthetic fit, we got to 712. And then from there, 712 to booked consult at a 38% rate, 490. And then and we collected the $35 deposit. So beyond her just booking a consult, she can also take payment. So the people that showed up, as you know, even if you charge $35 for a visit, once people pay you a certain amount of money, they are going to show up. So we had a huge show up rate, 93%, which is incredible for something that is AI automated. So only a 6.5% no show rate, and there's even an auto rebook function. So you can see the immense value that our Kaya AI plus our conversation AI plus one centralized communication brings to the table when we're looking at conversions and what do we do to optimize that. With that, I'm going to hand it over to John, and he's going to take the next segment.
Oh, awesome. Thanks. So I get to do the profit, which is kind of the best part of this entire webinar, right? Because everybody wants to make some money, and making money, handling the money is what's most important. So how do we get paid and how do we get paid faster? Vital Pay and MedPay both work together and they are separate. Let me explain. Vital Pay was created for AdVital on the back end. That gives AdVital the ability to create additional payment sections within their environment. MedPay was created as a standalone solution that provides security and compliance at the highest level. Next slide, please. So that was a little bit of a teaser, and I'll move into the other stuff later on, but let's talk about healthcare payments, where they are today and how they need to move forward. So healthcare today is old, archaic. Some places are starting to catch on with, some type of new type of payment link or the ability to tap to pay. But again, it's just not where it needs to be. I go to a doctor's office currently who takes my copay, pulls the credit card out of my hand, taps the pay, gives it back to me, and then guess what? 3 weeks later, I get a bill in the mail. 3 weeks later, I get a bill in the mail. $75 because my copay didn't cover. So what do I need to do? I need to then either call up my doctor or I need to go online and figure out that really weird link that they give you to be able to go in and collect the money. Kind of just doesn't make any sense. And a lot of doctors' offices today are kind of stuck within those 19, well, we'll move it into the 2000s. I was going to be, yeah, a little bit harsh, but we'll go like 2010 to where they're accepting payments. So what we do is completely different than what the current payment structure is. And we've created a platform that's going to be able to provide you the ability to accept payment in multiple different ways. And trust me, that's not why you got into medicine. There's a better way, right, Chris? So, what is MedPay? MedPay is a patent pending HHS recognized HIPAA compliance solution. Now, you can see that we have the little HHS logo that's on the top of the screen. What that does, it provides us as the gold standard within payments. Gold standard within payments within healthcare, very specifically. We're posted on the HHS site. We're in discussions with HHS currently to be able to advance our solution to exceed where PCI compliance currently is. So everybody kind of says, oh, no, don't worry about me. I'm good. PCI compliance is my protection and the carve out. Well, unfortunately, today, with the way that the new mandates are starting to be rolled out and the new initiatives for HIPAA compliance, you're not going to be protected. So what does that mean? So the new protections all revolve around EFI, electronic patient health information. Basically, what that boils down to is the transfer of patient data amongst all of your different fragmented solutions, as Bijal and Dr. Patel were both describing. When you put all of those together and you don't provide the right barriers to put in place to be able to filter out that information, it all gets scraped through and then packaged up. And when they go to pay their invoices, it gets put into that capsule, which everybody knows, right? The encrypted portion of that, and then gets sent up to Visa, MasterCard. Well, what all goes into that? Patient name, possible procedure, possible address, social security number. I mean, all of these different sensitive pieces of data that everybody doesn't want to share with the general public. But guess what? Unknowingly, a lot of these practices are doing this, and that's why we've created MedPay. MedPay takes that point of purchase, decrypts the token, pulls all of the data out, leaves just enough in there to be able to send it to Visa, MasterCard and say, is this card good? Is it not good? Then Visa, MasterCard sends it back down and everybody's protected. So in doing this, we now exceed PCI compliance and become the new gold standard within payments. And as you can see on the screen, it says built for healthcare, not retail. There's a big difference between what we do and what most of the other big providers currently have in the market space. Their solutions are built for retail. And oh, by the way, your practice, if you want to sign up, minimal friction, you can get an account, and then we start processing. But if you look at the fine print, they say we're not HIPAA compliant, nor do they profess to be HIPAA compliant. They say it on their websites, they say it in their agreements. They won't enter into any type of BAA, business associate agreement, with the practices, and that kind of leaves everybody exposed at that point. So what we took a good hard look at the healthcare industry and we said, we can't take our retail solutions and deploy that into healthcare solutions. So again, creating MedPay to be able to deploy into the healthcare community. And again, it's built for healthcare, not for retail. It improves collections. It reduces risk, as we've just discussed. There's definitely better patient interface. It automates workflows, and 100% of what we're looking to do is stay fully compliant within the healthcare environment. Now, how does this all boil down and what does that look like? There's three ways to pay, the same as take home. So this is specific to the VitalPay platform. What we've created is the ability, not just a choice of using a credit card or paying by a check or paying by ACH, or, oh, by the way, whoa, my goodness, I didn't know that my breast augmentation is going to cost me $150,000. So we've built finance into this. So our platform takes all three of those solutions and we've baked it in, all three of those different payment sections, and we baked it into one: financing, credit card, and ACH. The benefit of all of this, it gives the patient the choice on how they want to be able to pay. It also gives the practice the ability to uplift their profitability by creating these different ways for the patient to be able to pay so that they feel more comfortable and they're able to afford to get these procedures done. So financing is a big portion of this. Credit card is obviously a little bit less. And then there's ACH that offsets the credit card piece. And as you can see, as a practice, all three of these equal out to be the same payment that you would receive into your practice. Now, this is what it would look like on Amber's side. So she gets either an email that she clicks on a link, or she gets a text. And this is text driven. One link sent by text goes to her phone. The quote is completely itemized. You can see on the right side of the screen what that generally looks like, how she wants to be able to pay, and what her choice will be. So if she were to choose the finance, that's already baked into the quote, right? Then there's the card that's already baked into the quote, or there's the cash that's already baked into the quote. And basically what that does, it provides the practice the ability to balance out all of their profitability because there is one payment across three platforms. Now, you need to take a good holistic look at where every practice currently is. Every practice currently provides the ability for credit cards, ACH, cash, check, and then financing, which is separate from what they currently do. But what we've done is we've created an additional profit center for the practice. And how did we do that? Well, it's kind of like, well, how do you do that within payments, right? So what we've done is we take the fee of the credit card and we pass it on to the patient. Now, what that does, it alleviates the practice of up to 99.7% of all of their credit card fees. And when I say the 99.7%, because there's a little bit of a fee that needs to be paid to be able to keep the lights on the other side of this. But overall, there's a significant amount of savings that you'll experience within your practice that becomes that general revenue center, right? So, for example, this is a $150,000 a year practice. You pay about $4,692 per month. You see that in overall savings. That goes straight through. You can put it to advertising. You can put it to, well, you don't need to put it to the front desk any longer because Kaya is going to be able to take that over for you. So maybe you put it into a new piece of equipment that you may need to be able to increase your profitability, or something that's going to benefit your business. Or you could always just take it and put it down to the bottom line and increase your salary. But that's a $4,692 monthly savings, $56,304 on an annualized basis. And then over 5 years, that's $282,000. That's significant savings that gets put back into your general OpEx and you're able to utilize within your business. So what you pay in fees as you grow. And this is actually a really good slide. And it's a super cool graphic that Beejel made. I think it was at 3 o'clock in the morning that I saw, but we
I
won't get into that. I mean, she looks
I
super
don't
fresh.
sleep and I don't eat, John.
She looks super fresh today for three
Just
o'clock in the morning.
naturally, you know.
Yeah. So what you'll pay in fees as you grow. So basically what this graph shows is, yeah, you know what, you may be doing $50,000 today and paying only $1,600 in credit card fees. You'll save that $1,600 on the credit card fees by passing that on to the patient, right? But when you utilize Add Vital, you are definitely going to see an increase in your monthly volume. So as you see this sales increase, naturally, if you were to just pay normally for your credit cards, you'd see that credit card fee increase. But when you take the increase of profitability or volume on the top end from Add Vital and the saving, and you put it together with the savings of Vital Pay, you now have this significant amount of revenue growth as well as general savings across the board that you're able to put to the bottom line. And as you can see in these graphs, it's pretty significant as the business starts to grow. And it's almost exponential by about 2.5 times from 50,000 to 175,000. And as the business as the business scales and from 175,000 up to 200,000, and in the previous graphic, you had seen that there was a practice that's currently utilizing AdVital that went from, say, $300,000 a month up to $2.7 million a month. That's a significant cost increase for credit cards. And then when we step in with Vital Pay, it's a significant cost savings. So profits going up, as well as your volumes going up. You put all of that together, and everybody's super happy about the direction of their practices. And from that, I'll turn it over to Cecil again.
All right, so I just want to bring up a couple things on what John just talked about. John just showed you half of the picture. That's credit card processing fees. We did not even scratch the surface of the financing fees. They were 13.5%. So if you take those numbers and you say, if you did the same amount of revenue that was processed from ACH and credit card, and you took that in financing, you would even get 4 times as much as what we just showed on the screen. And so we are giving you conservative numbers to say this is what we could save you in terms of the processing that actually happens. All right, so how do we turn these patients into loyalty? And I think John was already talking about this. He was saying, how does the front help the stuff on the back, right? So as we streamline the processes in the front, you get more conversions in terms of patients. Well, that leads to more revenue that has to get processed. And so now you're adding even the conversion on the front that leads to even more conversion on the back end. So things that are 2x end up look like 6 or 8x on the back end because now you're getting the full throughput of compounding effects. Well, you can do this also in the way that you do follow-ups, reviews, re-engagement, and you put this on autopilot, right? Our cheapest patient is the word of mouth referral and the one that you already have. The people that are already in these databases, they've been sitting silent, catching dust in these EMRs, right? Now we're able to reactivate all of them, re-engage all of them. So if you saw that practice, we reactivated their entire database to get them from 350 to almost 800K in the first month. Forget about 6 months or a year later. It was instantaneous. Then from those patients that we're treating, there's review generation. So we're asking patients for reviews. It's automated in the process. There's reminders so you don't decrease no-shows. There's recalls, cross-sells, upsells, all the other things that happen in business. And then there's mass marketing campaigns. These are SMS and by email. SMS is the way to go. You have a 97% open rate. So if you're not using SMS in terms of marketing, in terms of your entire database, you're missing out on a lot of people that have already paid in terms of attention to see you, to know what your practice is about, to then do the next thing. So that means that you have 40% fewer missed appointments and you have a quick launch, right? That you can do this in your practice and all of a sudden it gets injected right to what's happening this week, next week, and the weeks that follow. Now, how do you get reporting on this stuff? And that has been the most painful thing in terms of practices because you have different systems in terms of the EMR, your QuickBooks, some marketing agency, all this other different stuff in between. And then you have your staff that have writing these things down in sticky notes and spreadsheets and random napkins, right? Since we've got it all connected in one system, nothing can be missed, right? And so we're getting actual revenue attribution, marketing ROI, revenue that's recovered, and then the time that's saved by our entire platform. So you can actually see it and say, hey, we're going to hold you guys accountable for what you guys say in terms of software. We fill that bucket and overfill it in terms of the things that we do for practices because we're there for every little step because we have our own practice and we've already filled the buckets to say, how do I make this easier for staff so they can connect with patients? Because ultimately, that connection equals conversion. And how do we do that? We eat the complexity of all the admin stuff that happens. So you have full on reporting from every little number. And this is how we turn it into a profit center to say, hey, what's your revenue per consult? What's your revenue per lead? What was yesterday's revenue? How do you see all the metrics that a CFO will look at in terms of your business? This is at your fingertips. Without having to ask a single question, it literally tells you what the most common questions are. You can see at the top of the command center what's working, what's leaking, where to focus this week. We simplify this in terms of Q&A, in terms of a dashboard that they can actually take actions from. You can go to catch.advital.app and see this live in terms of a demo account. It'll show you this collected revenue, lead recovery rate, response time. This has every single marketing and sales attribution number that you need to know to run your practice. It even tells you what the constraint is. Is it marketing or is it sales? What's my full funnel? How many leads did I get? How many people booked? How many people attended? What were the no-shows? How many canceled? What's pending? What's coming around the corner? And then it tells you the accountability in terms of how well your marketing is working, how well your sales is working. So you know where to go fix the biggest leak in your practice. All right, I'll turn it over to Chris for what one platform is built for. What's next?
So as you've seen, it's one platform, one patient journey from the first click to the lifelong patient. And here's how every piece connects. So that one platform, one patient journey starts with finding revenue, capturing revenue, and a piece that's purpose-built for medical. Because Vishal, I think, said it yesterday on a webinar the best. What do you think about Stripe? You're on mute. No, the face says it all.
Well, I didn't, because of you guys, I did not know that Stripe wasn't HIPAA compliant. And that is terrifying. At first of all, they charge 3.99 whatever percent. They keep upping it, and I'm not a fan of that. But second of all, they're not even built for the platform. And then as practices, we don't know that because they're clever on their marketing and they don't mention it. So that I think that's absolutely violating to not be forthcoming with practices because when you get dinged with a HIPAA violation, that is just, it's the most terrible branding and marketing that you could have. It's going to hit a Reddit thread and they're going to rip you apart. Am I right or am I right, Cecil?
Absolutely. I mean, and I think that one of the biggest pains is that most EMRs, their payment processing they're charging you for is built on Stripe in a non-compliant way, but it's still they still get away with it. So
I just rebranded Stripe as Strip. They're going
that's
to
what they do to
strip
pay.
you of your credibility.
Yeah.
And
But
that's it's all joking aside, right? But Chris, I think you can talk about with when you guys put the idea of MedPay together with the MedToken, the patent pending technology, you guys are geeking out on all of these things. I think the payment goes somewhere on a ferry and it comes back as far as I'm concerned.
right. And it's scary. I mean, HIPAA is the one thing dealing with practices and wellness. that is just, it terrifies people. So if you can take that out of play, and that's one less thing that you have to think about, plus you're saving money, plus you're capturing revenue, finding revenue, and all of it works together seamlessly, helping the front desk, helping everything grow. I mean, it's a one patient journey end to end. There's no gaps where revenue can be lost. And I mean, that one platform, it's tuned for how you grow, whether you're a plastic surgery practice or do aesthetic dentistry, or you're a med spa, or you're in the wellness and aesthetics clinic. It's really something that will help not only you, but it'll help your patients have a better experience. And what you're really there for with the business is to help your patients. That's what being a doctor is about, right, Dr. Patel? Yes?
Absolutely.
He's on,
Absolutely, Chris. Sorry, I was
but
muted.
he's up next. So I was trying to push right into it. So happy patients, happy lives, right?
Absolutely. And I
Chris,
think
that
the
was good. I just want to say that was a nice transition.
Yeah. And so introducing the, AI EMR, right? And so a full stack solution, this is kind of what we've been wanting in medicine for the longest time. Um, you know, when they first promised us that we're going to get electronic medical records, they didn't tell us that we're going to have to fill those out. They didn't say, hey, you're going to have to spend extra time on your weekends, after hours to fill them out because now this is going to make everybody be able to see these records. So far, there's not a universal electronic medical record, which means that it really was not purposeful in terms of what it was intended for. And so that was one of the reasons that we've now kind of expanding into a full stack solution to say, hey, what exactly is an EMR? Back in the day, an EMR was a library. It's a library of charts. And most of the time it's dead charts, right? Of things that people wrote down, they're incomplete, partial notes that are in there that don't even mean anything. So we wanted to make it useful. So that's where we're introducing this whole AI EMR, and it includes everything you've seen: capturing, converting, collecting, retaining, and it converts it to one intelligent record. The one thing that AI does exceptionally well is it can speak well when it has context. Now, where does the context live for a patient? Right now, it's all over the place. It's between the messaging, it's between the phone calls, it's between the EMR, it's between those sticky notes, and then any of those spreadsheets. So it's missing the context to be any good. So what we did is we're combining all these things so that we have a AI that actually can read the medical record, the conversations, the flow, the entire journey, knowing where they are to be able to do the next thing. And that's where we put all the power of AI to actually be an agentic AI for medicine that removes all the admin work. So much so that we even have pins that you could wear and walk in and walk out of rooms that it does medical notation for you. It scribes it all out, makes a note, but then it also does sales training for the people that are in the room. That all comes together so that now you can actually run your practice like a business that it is. Because healthcare is not only taking care of patients, it is the business of medicine as well. It's on both sides, especially with consolidation that's happening in this day and age. So you can see this, your whole practice is on one screen. What's happening today, what your AI receptionist is saying, how she's actually helping your staff members. You have scheduling, inbox, patients, revenue, marketing, all in one platform that then does all the necessary things for a patient to have being seen, felt, and heard.
So I just have to hype up this product for like one more minute, because the thought process, can you go back one slide, Clarice? The thought process that went into, and we just screenshotted part of this window, is incredible. It's been months of work, outside of the box thinking. This is our crown jewel, and we are going to be first to market when we bring this. It's absolutely incredible. If you've seen other EMRs, I call them, it's a very official term, I call them janky. Janky with a J. They were built, I think, before I was born, and I ain't no spring chicken. And it looks like, I think, what IBM looked like in the 70s or something. It's horrendous. They don't care about UI. They don't care about UX. Everything is gray. They hate color unless it's gray, navy, or black. And it makes people sad. Okay. It makes people sad. It literally rips their souls out. And what we've decided to do is completely come out with a product that I think is inspired from the inside out. So we didn't design our EMR to be the next version of Next Tech. We designed our EMR to say the question that Cecil specifically asked the entire team. He spearheaded the product and the vision, but he wanted everyone to contribute in. And I loved the question he asked because it was a very Henry Ford like question. And if you don't know this story, I'm going to tell it because it's really inspiring. So Henry Ford has this famous statement. He said, if I asked what the people wanted, they would have said faster horses. And I love that quote. I love that quote. Wait, did I get his name wrong?
No, no, you got it right.
Oh, well, why are you saying Henry Ford question mark?
It was just a joke.
Oh, okay. John, I'm
But
in the
kind of
middle of
like,
my poetic speech
wow,
here.
you brought Henry Ford
Um,
into the EMR discussion.
Chris, can you mute John, please? He's being disruptive. And so, but that kind of visionary thought process is exactly how we got into the automobile. And when you look at when you think about Steve Jobs and his philosophy and the way he thought about product, he didn't take BlackBerry, which was the mainstay device top of the market at that time and created BlackBerry V2 version 2. He came at it from a completely different perspective, which is the Leonardo da Vinci quote that simplicity is the highest form of sophistication. And it became user centric, user friendly, and you should be able to open the box and learn how to use this device because it's so intuitive. And that's exactly what we're building with our AI EMR.
Well said. And so, real practices, what do our current clients say, right? From a 2 month wait to a 12-month wait. That's literally same surgeon, same hours, just a different system, a different way to think about it, a different stack, right? No new partners, just every lead being managed, touched, followed up with, and reactivated. So the whole story in 7 Ps, right? The problem, we went over it. I think I suffered plenty from it. And then the proof, showing you exactly what it's doing right now, right? Right now in practices, the profit, John went over this in depth and saying, hey, and these were low numbers, right? In terms of the profitability that this platform can give you. And the patients, what are they getting out of it? They're getting all the best care in terms of the journey that they need to take. And then the platform, it's all one connected ecosystem, the product, the AI native EMR that's coming soon, and then the people, your team and ours. And I think, Bijal, you want to take it from here in terms of the people?
Yeah, let's go to the next slide. All right. So you can see the reason, oh, you got all the different P's of how we built this platform and then where we're going with it. So I want to invite you into the people part of this. Book a call with me, 20 minutes. I'm friendly, I'm funny, you're probably gonna have a good time. And I'll tell you one thing, I love money. And I love for you to make more money. And I don't want payment processor strip to make it. And I don't want some random other person down the street to make it. I want your practice to make more money. And I want you to buy back your time so you can have practice freedom and enjoy more of your life. That's why you got into this for. So, what happens on this call? First of all, there is no hard pitch. The product sells itself. It's amazing. If you want to be a practice that's looking to the future, cutting edge, spearheading new things, you know this is where it's at. AdVital is committed. Our vision is to be forward. We're going to innovate something that has not ever been seen in this marketplace. And the entire goal of it is to make sure that everyone within your staff, front desk, and providers can use it. And it's easy and it's simple. That's truly what the win is. And we want people to buy back their time so you can go hang out with your kids, you can go work out, and you can go enjoy your life. That's the point of this. So during this conversation, we're going to look at your tech stack. I've done hundreds of these calls, and I love finding money. It's like a secret talent of mine. Look at your current conversions. If you don't know your exact numbers, that's totally okay. We'll just kind of work our way through it. Like I said, it is totally tight-lipped. There is no conversation that leaves our conversation. So we'll assess your stack, your conversions, what are your tools, what do you do for lead to consult, lead to procedure, your accounts receivable, what are your processing fees? I know how to ask you all those questions that we need within the first 5 minutes. We'll then map the exact gaps, what's going on with those leads, the connections, where in the pipeline are things accidentally slipping through the cracks? Where does some staff might need some training? You probably have some A players who know how to do this in their sleep, and then you may have some people who need a little bit of support or training. And then the last piece is if it is a fit, I can show you the platform and take you into deeper depths. We only had an hour today, so I had to actually cut out a lot of our platform. But Cecil mentioned that we have our branded automations and workflows that we do. We also have an amazing support system and onboarding to white glove you through the experience of how do you get on board to the platform, and most importantly, how do you use it on a day-to-day basis. So we can go through all the other screenshots, show you all the cool things that we've built, and I'd love to see you there. We have a few limited slots this month, so just go ahead and book in with me. You'll find that link at advitalemd.com. It's got the book now demo button. Hit that. And what I want you to know, though, is that when you take a look at this platform and see how it fits into your practice, you're going to learn something from the call regardless. It is meant to be a forward thinking, where can you figure out how can you make more money with less time, less software, and less money going out of your door. So we're so thankful to have you guys on the call today. It was awesome to meet you guys. We're going to open up for a few minutes for questions. Don't hide. Come with your questions. You can challenge us. Tell us what you have for questions, or ask us if you have any questions. And then if you have any takeaways, would love to get your feedback. You've given us an hour of your time. What is your highlight from this presentation? What is the thing or feature or something you learned that got you the most excited? I'll wait for you guys to type that in. You can either type it in or you can unmute. John Lee learned about Henry Ford from Bijal Patel, and he's really excited. He really likes my poetic inspiration speeches. So, John, after this, I'm gonna give you a 20-minute session with me where I quote other people
Oh,
and inspire you for the rest of June. But yeah,
oh
no,
my
if you guys
goodness, I
have
can't
any,
wait.
you can't wait. All right, awesome.
Any any other questions?
Yeah, guys, feel free to
Here's one question
unmute,
here.
ask
Can
a
Kaya,
question.
there's a question here. So can Kaya take intake information verbally from a patient so they don't have to fill out anything from a link or fill it out when they come into the office? For me, that would be a bonus. So absolutely. So Kaya can take intake, verbally for sure. Again, the new and latest and greatest of the AI EMR, it can literally we use these little plug pins and we'll have the entire part notated and dictated so that it goes into the right place in the chart itself. So it can do that, or it can do a Q&A, and you can actually voice chat with it, having a patient to just take in the information for the initial intake.
Other
Great
questions?
question.
Great one.
Yeah, that's one of the coolest things on the entire platform. I'm glad somebody brought that up. So thank you. So yeah, I guess we were pretty comprehensive. Is there anything else that anybody can think of that maybe we didn't answer? We have just a couple more minutes.
Yep. Or let us know what your favorite takeaway was. What is your takeaway? What are you excited to see? That would also be some really great feedback. I know for me, I'm most excited about what we're building with, for the current state, I'm excited that we've got this partnership with MedPay and we've built out Vital Pay in our system to create actually HIPAA compliant payments. And whenever we're putting money back into the practices, bottom line, I think we're doing a service to our own industry. And if you're a leader in your industry, it is your job, it is your responsibility to improve the industry. And I just am really grateful to both John and Chris because this has been such a cool thing that we've done together.
And it makes a difference when you have a platform or you have technology that was built, purpose built with thought to solve a problem. Because a lot of the EMRs out there, like you said, they're just cobbled together because they build the tree trunk and then they have to put a branch on there like a Lego and it doesn't work exactly right. So when you start and you make a good plan, that plan really pays off for the customer. We have another question. After the audit, what is the time frame before you can set said practice up and running?
After an audit, what is the time frame? The practice can get set up anywhere between 2 to 6 weeks, depending on what we get done. So if you wanted just Kaya, Kaya is kind of a wham bam, thank you, ma'am kind of lady. She takes about 2 weeks for you to be able to set her up. The coolest thing that we do with Kaya is we make sure that she is, kind of behind the scenes and she's behind a black curtain, and then we take her out. For the platform at large, that can take up to 6 weeks, because if you want the EMR integration in, which I highly recommend, we it takes us a little bit of time to get the API key from your EMR of choice. So 2 to 6 weeks on average, four. So during that time, we'll get started with Kaya right off the jump. We'll get the API key put in. We'll usually get that within 2 weeks. Then our team, Selena, she's our client advocate. She's fantabulous. I love working with her. She will build out your automated workflows, email messaging, SMS, all of that gets built out, customized to your brand voice. So we make sure it sounds exactly like the practice, not like anyone else, because that is the highest chance of converting. And then we get all of your scheduling set up in the system. So yeah,
And
that's a
we
safe window.
and
We
we
have
have one more
one more
question.
question.
I think
Yeah,
it's about Cam Newton. I went to Auburn, so yeah,
yeah.
maybe that was a little stick. I don't know. But can Kaya handle multiple calls and tasks simultaneously?
Yeah. And so short answer, Kaya can handle 200 different calls at the same time and then also be functioning to do tasks as an agentic, employee for the entire staff.
Well, perfect. I think we've covered a lot, and follow back up with Bijal. I believe you look like you were wanting to say something real quick as I was
Yeah.
wrapping up.
Oh, yeah. I was just going to say with Kaya, the other thing about her is she also speaks Spanish. She's bilingual. So our practice, we have a Spanish speaking side of our practice as well, because we're in Texas, we're in Houston, so why wouldn't you? But if you just look at the country and where things are going, so think of that as well, in terms of maybe your staff right now, maybe you don't have a Spanish speaking person. Kaya can help fill in some of the gaps, for front desk, at least from that aspect.
That's amazing. I didn't know that. So I learned something today, and about Henry Ford. So, but
I think
everybody,
Henry Ford was very exciting in this conversation.
it was. So where do you go to book the audit one more time?
Advitalmd.com. You'll see there's a bunch of 20-minute type of slots. And can you have Kaya say something? Yes, we can. Go to our website if you go to advitalmd.com. And right there in about the middle of the screen, you can test Kaya. You can hear a recording of her if you don't want to actually call the number, or if you want to test her out yourself, you can actually call the number that's on the screen.
All right, perfect. Well, once again, thank you everyone for spending the last hour with us. I hope it's not the last hour you ever spend with us because we're looking forward to doing business with you and helping your practice. So, bye from everyone. Have a great day.
Bye.
Thanks.